in the course at the moment, we cover things like case formulations, risk assessment, risk management, everything central to the practice of forensic psychology. The difference between the forensic psychology and the forensic psychology and mental health course, so the current course that we're talking about, there's an element of mental health covered in that. So we cover the Mental Health Act, Mental Capacity Act, and how that is relevant for assessment and detention of forensic populations, and what that means for assessing the risk of the individual, both clinically, so what is the severity of the mental health, but also from a forensic side of what is the risk to themselves, to others, and the general public. So we're trying to assess the risk of individuals, but also public protection. And the course is very much focused on giving you the theoretical knowledge, but also the practical knowledge of how to assess risk and what it's like to actually work in practice. My name is Ravi Dave, and I'm an assistant professor in psychology. And I've taught across a range of different courses. Currently, I'm the course director for the MSc Forensic Psychology and Mental Health, both on campus and online. So I cover both the campus version and the online version for the same course. So it's applicable in the sense that we give very much a case study vignette focus. So what we'll do in our taught materials will certainly be independent activities that are focused on assessing the risk. So whilst we can't have patients come every week, we have scenarios of potential patient profile or their forensic risk that they in a vignette form, and we ask our students to case formulate that. So understand what might be the historical factors, what might be the current dynamic risk, what are the static risks, and how do you assess risk and risk management within that. So it's pretty much what you'd expect to do as a forensic psychologist. Risk assessment and risk management is a huge part of forensic psychology. So we're saying to our students, here's what a potential case profile would look like. These are the skills that are needed. These are the different mental health acts that you need to consider, or any frameworks, professional frameworks, and this is how you risk assess. So we're teaching them the practical skills, but still using theoretical focus. So we don't detach from theory, so they still need to know the frameworks, the theory, all of that. But it's very applicable in the sense that this is what you would do in practice, and this is step by step of how you would do that if you were in practice. So when our students go to practice, they're ready for practice. Yeah, so case formulation was an idea that we came up with because we're thinking where we always see cases, and sometimes students are thinking, well, how do you explain this case? What is it that we're looking for? Now, case formulation is very clinical in its approach. Now, that's where my background was, or still is. And we're trying to understand how can we merge things together, because with forensic psychology and mental health, you're not just working with forensic, you're working with clinical patients as well. The Mental Health Act, Mental Capacity Act. So do they have the capacity to make decisions? And mental health, what are the mental health considerations that we need? So this, in that sense, case formulation really helps that you've got the 5 Ps approach, which is central to the cognitive behavioral therapy, CBT, which is a key framework and the key kind of method that we use. And for that reason, we teach that. So when students go out there, they understand the psychodynamic, they understand the neuropsychological, they understand the cognitive behavior approach. And it is very unique because we've developed that with our students in mind of how they would need to work in practice. So yes, very much specialized in that sense and very unique in the assessment that we give to our students. Forensic psychology is really important for the reason that we're seeing a lot of offences at the moment. We're seeing the restrictions within prison services. Of course, resources are starting to become really limited, release of prisoners because of the lack of prisons, and generally the public protection. So how do we make sound decisions on risk, and how do we move forward with those decisions? So forensic psychology has become really important to know we're making the real correct decisions for public protection. So we're trying to understand what are the risks that people possess, and what is the likelihood of them acting on that risk. We do suggest that they do have some form of understanding of psychology, purely because the degree is BPS accredited. So we do expect that they would have some form of training in psychology. So any psychology or related discipline would be applicable for this course. And yeah, so BPS, because they should have some understanding of research methods, which is central to our understanding. And also, because it's a BPS degree, there are some core components they must have covered at undergraduate level for them to be on the course. So we do have a varied student cohort. So what we do have, we have students, like I said, who have interests in forensic psychology and mental health. Some students will come to see if this is the right step for them. Sometimes they'll come on to the masters. They're interested. They want to pursue a doctorate, which is the stage 2, which gives them the chartership in forensic psychology. But they want to, obviously this is compulsory. If they want to do stage 2, then it's compulsory to do the masters in forensic psychology, which is really important. What we offer is comprehensive course. So it is no different to doing the course on campus, apart from the fact that it's online. So we give them all the materials, all the learning. So whatever we do on campus is mimicked online, and they will have all the resources that they would have had if they're on campus. Now the experience is designed to be learn in your own time. So we give you all the resources, learn in your own time, and we also have tutors and support. So if there is any need for clarity, if there is need for development in certain concepts, then we have a team available who will support with that. We have a variety of different modules with different assessments. So like I said, we have a case formulation. We also have a risk assessment. Similarly, they would be given a case and they would have to assess the level of risk that they have based on different factors such as static risk, dynamic risk, and all those factors and how they play a part and what is the correct practice that should happen. So where should they be? Should they be in high secure, medium secure, low secure, or community-based prison? And that's a decision making that we teach based on how to assess risk. We have to also understand the BPS and the HCPC framework, which is the guidance for working in practice. And students would be made aware of that, and they would understand the key ethical tensions and frameworks such as respect, autonomy, at the same time as duty of care, and also making the best decision in the best interest for their patients or the clients. And that is another assessment that we do. And we also have research methods report, quantitative methods, qualitative methods. Now, quantitative methods looks at the more statistical side of data collection, data analysis and interpretation. And then we also have the qualitative side, which is, again, collecting data qualitatively, analyzing it, interpreting it. But there's a huge focus on clinical judgment, clinical reasoning, and clinical evaluation. So when our students go out there, they are fully aware of how to work with different situations, be it data, be it practice, be it risk, and how do they manage that, and how do they make the best clinical judgment, interpretation, and judgment of a situation. There's a huge component of it is independent project, where students learn how to write and disseminate independent research. So they'll choose a topic of interest within the forensic psychology and mental health. They'll have support to develop that into a dissertation. I think this course is recommended for all students who have an interest in forensic psychology and mental health. It builds on theoretical concepts that you know, and it's also about making sure that you're ready for practice. We are always thinking about employability. We're always thinking about the next step. So it's not just about going into a job. It's about making sure that we're getting you prepped, ready for academic route, which is PhD or further education, but also professional doctorates in forensic psychology and mental health. Our focus is on building skills, building knowledge, and building a sense of community. What we want to do is we want to instill you with knowledge. We want to instill you with skills, the softer skills such as presentation, group work, that are central to the practice of forensic psychology and mental health. But at the same time, we want you to enjoy the course. The course has been developed with students in mind. We have taken steps to understand what students need, what students want, and what does the future look like for students? What does forensic psychology and mental health look like as a field? And where is it going? So this course has been developed with real knowledge of where the evidence is, what the student needs are, and how do we use forensic psychology and mental health in the future. So this is not just for a course for now, it's a course for the future. And with constant development of the course, the refinement and the course quality monitoring of the course, that's where we differ. So my favorite module on the course would be the forensic mental health and the criminal justice system module, purely because it's purely assessment driven, which is a case formulation. And with my background in forensic, clinical, and social psychology, it brings all my areas of expertise and my interest areas together. So I really enjoy understanding what is the forensic risk here? How is that motivated by the mental health components, so the mental health of the patient or the client? My recommendation, obviously, adolescence is one of them. There are quite a few. I tend to go for more international cinema as well. Anything related with crime. I've been watching, or I have watched the early series, and there's currently one at the moment about the Indian Predator. And it talks about the reasons why somebody has become a criminal. What were the situations? What was the sociological events that happened? What was their psyche? What was their upbringing, attachment? Everything that we cover in theory was actually shown as these were the fundamental factors that led to the criminality later. And it was really interesting because I psychodynamically inclined, I think the first 7 years become the script, and that is the hidden emotions, thoughts, ideas, schemas, the unconscious processing or the subconscious processing of how we behave, and that how it manifests later on in life. So somebody would have no risk at all, and all of a sudden they have a trigger, they exacerbate, and there's criminality, they become engaged in an offence. Where does that come from? Earlier years, the script may have been written, but it's only later on in life that it's come out. So there is this whole idea of psychodynamic is a little bit non-falsifiable. There's no way of testing it, but from a purely psychodynamic and from that kind of thought where there's subconscious, unconscious, I believe there are some scripts that we learn, things that are repressed, which do come out later under the right situations, under the right circumstances, under the right triggers. We're all potentially capable of things that we didn't think we were capable of.